University Hospitals Birmingham has admitted hundreds of people with flu in the last few weeks. They're not unusual. Across England, hospitals are close to full, and the consequences for patients being rushed to hospital are now clear, in record handover delays. Last week, more than 40% of ambulances were delayed more than half an hour getting people into A&E. Things outside this trust's hospitals were worse than average. Half of patients brought to hospital by ambulance waited at least half an hour to be handed over to A&E teams. A third waited more than an hour, and those ringing for an ambulance had long waits too. Sumitri Chakraborty is a Birmingham GP. She's starting to see people turning up with chest pain, even stroke symptoms, who are walking into her surgery because they're scared they'll wait too long to be seen at A&E. Last week, she called an ambulance for someone with suspected sepsis.
And when we call an ambulance for sepsis, it comes under category 2 standard in ambulance. So the standard time for ambulance reaching us should be 18 minutes, not more than 18 minutes. But it took hours for the ambulance to come. And we are scared because we do not have everything to manage. Yes, we have IV antibiotics, we have things, we have a crash trolley to manage patients. But we are not so well equipped like secondary care, like A&E, to manage the patients. So we are scared and we are monitoring the patients. We are continuously with the patients. We are continuously on phone with the ambulance. We are trying to manage the patient. At the same time, we are trying to bring the ambulance in.
Last week, more than 5,000 people were in hospital with flu, nearly 7 times the number at the start of December.
That's been piling enormous pressure on NHS services that are already very stretched. Now, there are some signs that flu and COVID may be turning over and we may start to see some decreases, but I think we need to be cautious.
The Health Secretary was in a London hospital today. He said money is being spent to ease the gridlock stymieing hospitals.
We've got to relieve those who can leave hospital but are often stuck on the wards. So that is priority. It gets the flow into the NHS. It relieves pressure on the front door. That's why we're targeting the extra 500 million this year. But of course, next year, there's a further 2.8 billion going into social care, targeted at this issue and getting people out of hospital who are fit to leave.
And last week, on average, 12,000 people were ready to go, but couldn't. The big issue, creating problems all the way back up the line.
Well, I'm joined now by Nigel Edwards, Chief Executive of the think tank, the Nuffield Trust. Obviously, it takes time to train new staff and build new hospitals. What could be done quickly to try and get the NHS flowing again?
Well, the big problem where quick action might make a difference is, as we've heard in that report, at the discharge end. One of the problems we've got at the moment in ambulances is that they can't discharge, they can't unload their patients into the emergency departments, they can't send their patients into the wards because the wards have got people in them who are waiting for discharge. There's about 12,000 or 13,000 people who could be somewhere else, but the social care, the healthcare community services and nursing homes don't seem to have the capacity to deal with it, and that would help to unlock things and would cause a lot of pressure to be relieved.
How would you create that kind of capacity, though? I mean, we used to have cottage hospitals and district hospitals, and they were all closed down over the last 30 years.
They go on, and to be honest, they're probably not the full answer. A lot of these patients need to be at home, but they need support at home. The real problem is that social care, despite promises to the contrary, is not fixed. It is in a mess. There are a very large number of vacancies. They're outbid substantially by other employers, particularly in the retail sector, and they've had a great deal of uncertainty about, although there are promises of money, will it get through and will it be enough? Can they invest in creating jobs, paying their staff more, providing the sort of career development and staff training that's required to make social care work? And if I was them, I'd be very nervous about that. And I think we've seen that. The care home sector got a real battering during COVID and has had some serious problems. So there's going to be quite a lot of TLC, tender loving care, required to really rebuild that social care system. And community nursing is another problem. We've had big vacancies there. We've not trained the staff, and that workforce is ageing and increasingly retiring, particularly given the pressures that they've been facing.
Some people have suggested reopening the Nightingale hospitals as a way of freeing up those beds. I mean, is that a realistic proposition? Could you find the care staff to sort of man those?
Well, they're not really terribly good environments for people. People who need to go home need to go home. If they stay in hospital-type settings, they what's called decompensate. Elderly people lying in bed lose muscle tone very rapidly. They learn to become dependent. It actually prevents their return home very often. So getting people into the environment in which they normally live with proper support has to be the answer. The Nightingale hospitals are cubicled areas in things like warehouses, and I think we should really avoid that, and it would not be good for them, and we may actually not be able to staff them because, as you know, one of the major constraints that the NHS and social care have been suffering from for some years is a significant shortage of the right sorts of staff.
So there is no quick fix, is what you're saying? This is all quite depressing.
That there is no quick fix. We shouldn't be starting from here. We've seen this problem coming. It's been made worse by flu and by COVID, but the problems in social care have been known about for a very long time, and successive governments have failed to act on them.